Imagine this for a second. You hire someone on a Monday.
A critical new team member.
Right. They see their first patient on Tuesday. And that Tuesday might be the last time you see them in person for months.
If you're lucky, you might not see them again until the Christmas party.
Or until they come in to drop off their resignation letter.
And that gap, that huge physical distance, that is the core challenge. Traditional onboarding, it just wasn't built for this.
We're talking about building a sense of team, of belonging, when your employee's office is their car.
Or their phone. That's their real office.
And this isn't just an HR problem anymore. It's become a full-blown crisis. So our mission for this deep dive is to tackle that isolation. We're going to unpack something called the Tether Strategy.
It's a 5-point plan made to create what you might call digital proximity for these teams that are always on their own.
And we have to figure this out because the scale of the problem is, well, it's pretty staggering.
It is. The home care industry is facing a massive retention problem. We're talking about turnover that has now climbed to nearly 80%.
80%. 8 out of 10 people. That's just, it's an exhausting number.
And what's really wild is that the data doesn't just show how bad it is, it shows how fast it happens.
Okay, so what are we looking at?
So the 2024 Activated Insights Report, it puts the turnover rate at 79.2%, the highest since 2018.
Okay.
But here's the stat that should keep people up at night. 4 out of 5 caregivers, that's roughly 80% of your new hires, they leave within their first 100 days.
Wow. They're gone before their probationary periods is even over.
Exactly. Gone before they've even really delivered enough value to cover the cost of hiring them in the first place.
Which means the agency is just constantly recruiting. It's a financial black hole.
It proves the problem isn't just the job is hard. The problem is something breaks right at the very beginning.
Okay, let's get into that.
Yeah.
Of course, we know the usual suspects for turnover. The work is demanding, scheduling is a mess, the pay can be low. Right. But for people leaving that fast within 100 days, the sources we looked at point to something deeper. Loneliness.
Yeah.
Just profound professional isolation.
You're right. A caregiver isn't a remote worker like an IT person working from home. They are solo workers.
That's a great distinction.
They're with patients, sure, but they don't have those little moments of decompression. You can't just turn to a coworker and vent about traffic or ask a quick question.
There's no water cooler.
There's no water cooler. And that lack of connection, it has a real measurable cost.
How so?
Well, Harvard Business Review did this study. They found that isolation among remote workers costs U.S. employers, get this, $154 billion a year.
Billion, with a B.
$154 billion, and that's just in absenteeism. Now imagine that in home health, where the work is so much more emotionally taxing.
So if you can't always compete on salary, and let's be honest, most can't.
You have to compete on connection, you have to compete on engagement, you have to build an onboarding process for the reality of the job, not for an office that they'll never see.
And that's where the Tether Strategy comes from. I like the name. It assumes the opposite of normal onboarding.
Right. It assumes no one is there.
So the goal is to use these digital touch points, these tethers, to just constantly send these small signals that say, we see you, you're part of the team.
And it all starts in maybe a surprising place, the paperwork. Tether Point 1 is all about mobile-first compliance.
Okay, that sounds really clinical. Why start there?
Because that's where the first bit of friction happens, and it's a silent killer of motivation.
What do you mean?
Think about it. Your new hire. They're excited, but they have all this orientation paperwork to do, and they're sitting in their car, maybe with 12 minutes before their next patient.
Okay.
Can they pull out their phone and get it done? Can they do their I-9 verification, sign policies, upload their license? Right there.
And if the answer is no?
If the answer is no, you've just told them that your process doesn't respect their reality. You're making their life harder from day one.
So forcing them to go find a desktop, or God forbid, a scanner, is like an administrative reason to quit.
Precisely. And we're talking about specific things here. You need to be able to do an I-9 by just taking a photo of your ID. E-signatures have to work on a phone. You need to be able to upload a certification straight from your camera roll.
In the training modules, they can't require a desktop browser with Flash or something.
Absolutely not. The system has to work for them. And this links directly to retention. There's data showing 69% of employees with a structured, easy onboarding stay for at least 3 years.
And for these workers, mobile first is the structured process.
It is. Every time they have to use a laptop, it's a reason to just give up.
Okay, so if mobile first compliance fixes the administrative friction, what about the emotional side? That brings us to tether point 2, which is video welcomes.
Yes, this is so important. It's the replacement for the CEO handshake they're never going to get.
And the sources break this down into 3 types of videos. The first is the leadership message.
Right. A short 90-second welcome from the CEO or the director of nursing. And it's not about logistics. It's about why the work matters. It's a human saying, "We're glad you're here."
The second type is the team introduction.
Yeah, short clips from actual peers, experienced caregivers sharing what they wish they'd known on day one.
Like practical tips.
Exactly. Like where to park or how to handle a tricky scheduling thing. It just says you have colleagues, even if you can't see them.
And the third one is what they call the day in the life reality check.
This one is maybe the most important for that 100-day problem. It's an honest video showing what a shift is really like, the traffic, the tough moments, all of it.
Isn't there a risk that will scare people off?
It actually does the opposite. It manages expectations. People quit when the job isn't what they thought it would be. This reduces that shock.
And does it work?
The research is pretty clear. Companies using video in their onboarding see an 86% retention rate. That's a 30-point jump. And it doesn't have to be fancy. Authenticity is what matters.
That need for a real connection brings us right to tether point 3, the buddy system. This seems like the ultimate lifeline.
It is. Let's paint the picture. It's 10 p.m. at night. A new caregiver is in a home they've never been to, and a family member is asking a tough question about medication that's not on the care plan.
We're alone. They're panicking.
Exactly. They aren't going to call some after-hours line and feel stupid. They're going to feel isolated, and they might just quit the next morning. A buddy prevents that.
But doesn't that put more work on your existing staff, risking burnout for them?
That's a great question, but the data actually shows it helps everyone. Both the mentors and the mentees have retention rates that are 20 to 22% higher than people not in the program.
So it actually makes your best people more invested.
It gives them a sense of purpose and leadership. So a buddy.
Right.
It's not a supervisor, right? It's a peer, someone who remembers being new. They're just available by text for those, stupid questions.
And the key tip here is to match them geographically.
Yes, that's huge. So the advice is actually practical. Oh, you're in Riverside. I know that street. Don't park there. Park around the corner. It makes the connection real.
Okay, so that covers connection. But what about the harder side of this, the risks?
Which brings us to tether point 4, essential safety checks. And this is completely non-negotiable.
The reality is pretty terrifying. Caregivers are walking into strangers' homes alone, often at night.
The injury rates are more than double the national average. And studies show anywhere from 18 to 65% of them experience verbal abuse.
So safety can't just be a form they sign.
It has to be integrated into their daily work. It starts with mobile pre-visit protocols in their app. Just simple questions. Are you comfortable with this neighborhood? Do you know where you're parking?
It forces them to think proactively.
Exactly. And then you need a super simple escalation procedure for when things go wrong, something they can remember under stress.
Like what?
We recommend a 3-step process. Leave immediately. Text your buddy. Call this one specific safety number. Simple.
And the training has to be based on real life, not just theory.
Yes. Use anonymized incident reports from your own agency. Ask them, okay, the patient's son is acting aggressively. What do you do step by step right now?
That kind of real-world training must feel so much more valuable.
It is. And the last piece is a monitored check-in system. Just a simple text when you start a visit and when you end it. If you don't check out on time, someone is alerted.
It's not just logistics. That's proof that someone cares if you get home safe.
It's a literal tether.
And that idea of someone actively caring is the perfect transition to the last point, tether point 5. Regular micro-touch points.
Because the biggest risk after a good orientation is silence.
Right. Suddenly the organization that was so welcoming just feels gone.
So you need a predictable communication plan for the first 90 days. Has to be structured.
What does that look like?
Week 1 should have daily check-ins, a quick text or a 5-minute call from a supervisor or their buddy.
You're front-loading the support.
Exactly. Then for the rest of the first month, you transition to scheduled calls. Every Tuesday and Thursday afternoon, a 15-minute check-in. The consistency is key.
And then you have the big milestones.
Day 30, 60, and 90. These are formal check-ins to ask the hard question. Do you see yourself here long-term? What's one thing we could fix for you right now?
You're trying to find the problems before they become resignations.
You are, and you're also creating moments of acknowledgement. For a solo worker, being noticed is the only proof their hard work matters.
So celebrating their first complex case, or their first piece of positive feedback from a family.
Yes. A supervisor just needs to send a quick text saying, hey, saw you handled that tough situation. Great job. Like, that tiny moment can bridge that huge gap of isolation.
Okay, this has been a really dense deep dive. For you, the listener, we know that's a lot to take in, but you don't have to rebuild everything at once.
Right. The sources give 4 really simple, low-friction places to start. Like this week.
What's the first one?
First, audit your own mobile experience. Sit in your car and try to complete your own onboarding paperwork on your phone. See how frustrating it is.
Okay, number 2.
Record one video, just one. Have the director of nursing use their phone to record a 90-second message about why they do this work and send it to your next new hire.
Third.
Assign a buddy. Don't build a huge program. For the next hire, just find one experienced caregiver and ask them to be available by text for the first month.
And the last one.
Map your real safety gaps. Ask your newest hires, what did you wish you knew before your first solo visit? Their answers are your new safety training curriculum.
When you put it all together, it really paints a picture.
It does. I mean, agencies that obsess over recruitment but are losing 80% of their people in 100 days, they're just filling a leaky bucket.
The winners are the ones who stop ignoring the isolation.
The ones who use these tethers to build connection, they make their caregivers feel like they belong even when they're totally alone.
Your caregivers chose this work because they care about people. The whole point of the Tether Strategy is just to prove that someone cares about them. So here's the final thought for you to take away.
What piece of your essential employee information still requires a desktop computer? And how many caregivers did you lose last month because of that one single friction point?